Hello, my dear friends. Welcome back to another interesting episode of Manju's Testimony. Today, I'm going to talk about OET listening. Before that, I would like to express my sincere gratitude to all of you for giving me good response for my last reading video. So, I promise you that this video also will be worth watching, and I would like to explain what I'm going to talk in this video. I have a question extract and the audio. So I will play the audio and the question extract at the same time. But in between, I will cut the audio and the question extract after each question and let you to find out the answer. So it will help you to understand the accent and find out the answers by comprehending the language at the same time. So this one is also like a real scenario, but I'm not doing a mock exam, or this is not a model of the listening exam. Okay, this is a way of teaching you how to understand the accent and find out the answer at the same time. Before going to start the questions, I have to remind you some points about listening that you have to keep in mind while you're practicing. Listening is all about understanding the accent. So we have to understand their accent and try to understand their pronunciation to get the meaning of what they are talking about. So this is all about your exposure to different accents like Australia, New Zealand, then European accent, and get familiarized with the accent. So all you have to do is to get yourself explore with a lot of accents, pronunciations to catch the meaning of what they are talking about. All the pronunciation what we are using in our conversation is literally wrong. Whenever a native speaker talk about the same thing, I mean a very normal thing, we cannot get the meaning because their accent is little bit different. For example, in our Indian accent we say water is water, but it is not like water, it is like water. Our pronunciation is not that much prominent in native speakers language, but we specially give stress to R when we speak. So this is the difference in the accent. It is an example of the differences in accent. So we have to understand the changes in between our Indian accent and the native speakers accent. This is the task that you have to fulfill to get a good score in OET listening. So welcome again to Manju's Testimonies, another episode. So what you can see is our questions. For easiness, I'm using my laptop because the phone is being used for capturing the video. So that's why there is an introduction, right? So this time we have to utilize to start reading. Please don't waste your time to get what they're talking about. You have to start from the beginning when they start talking about the introduction. So let's play the audio right now.
Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract. And you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1.
So that's about the introduction. Did you notice they talk about almost 1 minute? 1 minute and 3 seconds. And again, they will give you 30 seconds to read the questions, right? So you will totally get 1.5 minutes to read the questions in part A listening. I mean, one of the extracts in part A listening. So that time is pretty. So you will get enough time to read all the questions, understand the meaning, and at the same time you can guess some of the answers even, and to wait for the audio track to come in. Okay, so this is the exact way that you have to follow in the beginning of the listening exam. Okay, so guys, now I am going to play the audio. Keep your concentration fully in the audio track not to read the questions, but at the same time you can do one thing, just move your eyes over the. We have already read all the questions, we got more than 1 minute to read all the questions, and we assumed some answers as well, right? So this is the time to listen to the audio. Okay, so your concentration must be in the audio, not to read the questions, but you just have a look at the questions as well. Then only you can understand what exactly we have to track from the conversation to get the answers. We need the answers only, right? We are not trying to comprehend all the meaning from their talking. We don't want that. We are trying to extract the answers. For don't put your complete concentration in reading, but you must be concentrate to the audio well. Okay, this is what you have to do to get the answers for listening questions. So guys, let's start answering the questions, and please try to comprehend the audio as per your own way, and try to comment your answers in the comment section, and I will tell you how I got the correct answer later, and I will explain you how I comprehended their conversation. How could I understand their pronunciation to get the correct answer for our questions. Okay, so let's do it right now.
Extract 1. Questions 1 to 12. You hear a gastroenterologist talking to a patient called Simon Mortlake. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Now, Mr. Mortlake, I think you've been referred by your GP. I've got your notes here, but perhaps you can tell me in your own words what seems to be the problem. What's brought you here today?
Sure. Well, it's not the first time I've been to this clinic. I was referred to one of your colleagues about 3 years ago. I had what I thought was a stomach ulcer, which had been troubling me for some time, and my GP suggested I came in for tests. And I had what he called an endoscopy, you know, where they put a tube down your throat and have a look at your insides. And as part of that, they also did a biopsy to make sure it wasn't something more serious.
That's right, and that was clear.
Yes, it was, fortunately. I actually had a condition called Helicobacter pylori, and I went on a course of tablets for that.
Right.
It was cleared up in no time, very straightforward. But the consultant did say that I needed to be alert for any further symptoms. You know, that there's a greater risk of cancer developing after you've had that, and that I should come straight back if I had any problems.
Oh, indeed. And have you had any other medical problems since then?
Well, a couple of years back I had a hernia operation. That was also very straightforward. I had that done just after I retired. I expect it was actually an occupational injury of some kind because quite a few of my colleagues have had similar problems.
Okay.
I was a police officer for most of my working life. Other than that, I keep relatively fit. I'm not taking...
So guys, hope you have concentrated well in the audio. And by the way, it was a very nice audio track, and it's very easy to comprehend conversation. So let's see now how I comprehended. I think most of you got the correct answers. Please comment below. Just pause my video right now and comment below, and try checking again when I reveal you the answers. Okay, so now let's see how I comprehended this audio track and how I could find out the answers from that conversation. So let's see it right now. So I'm doing my laptop because my phone is already capturing the video. Okay, so let's see the...
Now, Mr. Mortlake, I think you've been referred by your GP. I've got your notes here, but perhaps you can tell me in your own words what seems to be the problem. What's brought you here today?
Sure. Well, it's not the first time I've been to this clinic. I was referred to one of your colleagues about 3 years ago. I had what I thought was a stomach ulcer, which had been troubling me for some time, and my GP suggested I came...
So that's about the audio. What did you understand from that audio track? So this patient has been referred by his GP to one of the consultant. I think it's a gastroenterologist. Now the situation is like this. He has been referred by his GP to a gastroenterologist. That is the female doctor who's talking in this audio. And he told her that he had been referred by his GP before to one of her friend for something happened to him like a stomach ulcer, and he had been facing it for some times, and his GP or the enterologist suggested him to do the endoscopy. So, endoscopy in our question paper, endoscopy is written after the first question, right? So that means the answer for the first question is already over before he spoke about the endoscopy, right? So our first question is already over and the answer is stomach ulcer. Okay, so this is the way you could find out the answer. And one thing you must not forget to notice, the we are talking about the patient's history. It is written in the left part of the question that it is the patient is talking about his history. So let's see the next question.
An endoscopy, where they put a tube down your throat and have a look at your insides. And as part of that, they also did a biopsy to make sure it wasn't something more serious.
That's right.
He told her that he had a biopsy and the doctor replied that and it was clear, right? So what was mentioned in the question? So let's see the question. I have some problem to minimize the audio and the question extract. That's why it's quite difficult to handle the audio and the question at the same time on the screen. Okay. So literally I need 2 phone and 1 laptop. But it's quite difficult. Okay. Okay, endoscopy. After the endoscopy, he was talking about a biopsy, and he said he had done with a biopsy, and the doctor replied that, and it was clear, right? So we had clear in the bracket here. So they were talking about the biopsy. The biopsy was clear. So this is the answer. So let's see the third question now.
Fortunately, I actually had a condition called Helicobacter pylori, and I went on a course of tablets for that.
Right.
It was cleared up in no time, very straightforward. But the consultant did say that I needed to be alert for any further symptoms. That there's a greater risk of cancer developing after you've had that, and that I should come straight back if I had any problems.
Oh, indeed. And have you had any other medical problems since then?
Well, a couple of years back I had a hernia operation.
So what he was talking about, he talked that he had an infection with the Helicobacter pylori, and he said after a course of antibiotics or treatment, he got this one cleared. He got this infection clear. So successfully treated for dash medically. So successfully treated for what? Helicobacter pylori. But now I think that in the question paper in the bracket they mentioned 3 years ago clear medically. This is something for you to get confused. Actually, in the real listening question paper, I won't expect this type of things in brackets. Maybe you will get, but I'm not sure. Maybe you will get a confusing question paper. It's as per you, your luck factor determine that. Okay. Anyway, this question paper it is written like clear. So from the clear we understood that it was talking about the biopsy. So that was relevant there in the second question. The clear in what they have given in the bracket was literally relevant. From that clear only we got the correct answer. But in the third question they have given medically, a word medically in the bracket, but that word has nothing to do with it, I guess. So successfully treated for Helicobacter pylori. He talked about Helicobacter pylori was treated successfully with a course of antibiotics or some medications. I heard something like that because the audio already finished. Now my question paper is on the screen. Okay, I'm sorry for that. So now let's see the fourth and the fifth question together because I'm running late to attend a very important thing. So that's why let's solve these questions together. So let's play the audio now.
Wobbling me for some time, and my GP suggested I came in for tests. And I had what he called an endoscopy, where they put a tube down your throat and have a look at your insides. And as part of that, they also did a biopsy to make sure it wasn't something more serious.
That's right, and that was clear.
Yes, it was, fortunately. I actually had a condition called Helicobacter pylori, and I went on a course of tablets for that.
Right.
It was cleared up in no time, very straightforward. But the consultant did say that I needed to be alert for any further symptoms. That there's a greater risk of cancer developing after you've had that, and that I should come straight back if I had any problems.
Oh, indeed. And have you had any other medical problems since then?
Well, a couple of years back I had a hernia operation. That was also very straightforward. I had that done just after I retired. I explained suspect it was actually an occupational injury of some kind because quite a few of my colleagues have had similar problems.
Okay.
I was a police officer for most of my working life. Other than that, I keep relatively fit. I'm not taking any medication for anything. I've been well until just recently.
Okay. So what's happened to change that?
Well, I've started to suffer from indigestion.
See, that's about the first part of our listening question paper extract 1. Okay, I'm not going to do the next part because I'm a bit late. So let's talk about these questions now. So for the third question, he talked about he had an infection with the Helicobacter pylori. After a course of tablets, he could get treated with that. And after that, he was talking about something related to Helicobacter pylori that his GP told him to make sure that he is not getting anything, any complications like a cancer, because sometimes it may contribute to cancer, right? The infection with the Helicobacter pylori. Then later the GP was asking about some other any other medical issue. Then he told that he had an operation for hernia, and then he said he was a police officer for most of his lifetime. So he feels that most of the people under this profession may get this problem because some of his friends also got the same. So he had an operation for this hernia. So from this long conversation, what we could understand that he had an operation for hernia and he is a retired police officer, right? So but there is a chance of confusion in between cancer and hernia, because in between they put cancer to make us confused. The GP told him to make sure that he is not getting any complication for the infection that he got affected with, like Helicobacter. Then later he was talking about the hernia. When the gastroenterologist asked about another medical condition, he talked about the hernia and he had an operation for that. And he feels that, or he assumed that this is a part of his profession because many of his colleagues got the same problem, right? So this is all about the audio extract. So this is the way you should find out the answers for this question. You have to concentrate well to the audio to get the to comprehend their conversation. So this is the way you should follow the practice. Okay, thank you for watching this video, and I hope this video is helpful to you. I'm sorry for not posting video for the last 3 weeks. I was a bit busy. You can expect good videos from me. Follow my channel and do like, share and subscribe. Thank you.